Doctors of Reddit, what was the wildest self-diagnoses a patient was actually right about? Story 1. I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising really easily and had petechiae. I wanted to go to urgent care where I knew the CBC was done quickly on site, but he instead wanted to wait to go to his primary. I took him to his primary and had a bag packed for the hospital in the trunk. The doctor told him it was likely a B12 deficiency but that he'd do blood work to put my mind at ease anyway. I asked if the CBC was done on site or not, and he said it was sent out. I asked if he planned to rush the CBC. He got very angry and said, "There is nothing the CBC could show that would change my treatment plan." Then he told my partner he needed to stop me from Googling. We got a call that night from the lab that his WBCs were dangerously high and platelets were dangerously low, and I had to immediately take him to the ER. I did, and he was diagnosed with acute leukemia. Story 2. One of my dearest friends from middle school was suffering from absolutely devastating medical issues. She went from bright and thriving in university to having to drop out before she graduated because her health bottomed out. She lost her job that paid her a fantastic amount. Basically her entire life fell apart. She was telling me about the new weird thing happening with her, some strange anemia that was found to be the result of abnormally low ferritin in her blood, which is what enables your red blood cells to carry iron. That was when something clicked in my brain: horrible digestive issues, peculiar anemia, chronic infections in her spleen that required a splenectomy, would sunburn to a blistering point in less than a half hour, a diagnosed allergy to sulfa drugs, horrible reactions to carbamazepine, retinol gave her a suppurating skin rash. I'm a pre-med dropout, and one of the first classes I took on my path to pre-med was an undergrad course in rare conditions and diseases, and one of the ones we discussed in our inherited disorder segment of class was porphyria. There's an easy way to tell if someone has porphyria: have them pee into a clear plastic or glass cup and expose it to direct sunlight. In a period of hours to days, the urine of people with porphyria will turn from clear or yellow to a wine red or wine purple. So I asked her if she trusted me enough to do something weird, told her to get a clear plastic disposable cup from her kitchen, pee in it, and put it in her windowsill where nobody could see it, and if anything about it changed, come tell me. Approximately 4 hours later, she called me on the phone screaming that her turned purple red like a vampire, and I told her she needed to go to the doctor and get tested for porphyria. 2 weeks later she tagged me on Facebook calling me lesbian Dr. House because she was diagnosed with congenital erythropoietic porphyria. Edit for everyone saying I stole this from Scrubs. I didn't even know Scrubs had a porphyria episode, so I looked it up and it came out a full year after this happened. Also, watching Scrubs and giving someone a DX doesn't cost you $100,000 that you end up having to pay back for 20 years. Story 3. This is why I usually ask patients what they think is going on, or if there is anything they're specifically worried about. Either I get a good idea, or I can figure out a way to make them feel better about their concern. Story 4. Emeka Doc here with over 10 years of experience. While it's not quite a diagnosis, experience has taught me to take very seriously when a patient states he's about to die, even if he appears in a stable controlled condition. Patients who have a life-threatening condition usually have a premonition about their imminent decompensation, which is usually preceded by very subtle signs of worsening that may be confounded with pretty much anything that happens on a resuscitation room or on the back of an ambulance. I've had patients who appeared to be in a completely stable condition, with acute conditions where cardiac arrest was not foreseeable, example motorcycle accident with single limb injury, who briefly mentioned they think they are about to die before suddenly entering in cardiac arrest due to a malignant arrhythmia. It's believed that patients may perceive a sudden drop of blood pressure and/or the usual release and spike of adrenaline and other catecholamines as imminent death, but the reason why this happens is not clear. Some we are able to return, others we lose, or recover them to a state where death would be better. Story 5 had a patient who came into the ED with vague mild abdominal pain whose friend recently died of colon cancer. She was convinced she must have it too, told her cancer wasn't contagious like that, but ordered a CT scan because she was so insistent in order to reassure her. Lo and behold, she had a huge colon mass. Very bizarre case. Story 6. Woman in her 40s came in and told me she was having seizures. I asked how she knew and she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms more associated with classic seizures, but I ordered tests anyway. Turns out she had been having multiple focal seizures. Story 7. Not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he was sitting on the couch or recliner. He would walk up, sniff and keep sniffing until my uncle would shoo him away. A bit later he would come back, sniff again and just stare at my uncle. A few weeks later my aunt was watching one of the local news channels and they featured a dog that could smell Parkinson's, and she jokingly told my uncle about it. He mentioned their dog constantly sniffing one spot and one spot only on his back, so he went to a high school friend who was a doctor in dermatology. He said it didn't look right and did a biopsy on it. Sure enough, he had skin cancer, but they caught it early and all he ended up with was a scar on his back. Story 8. Patient here told my family GP who I'd seen since I was a kid, and who worked with and saw both my parents as patients for years, that I thought I had reactive hypoglycemia. He scoffed, "You don't have that. Why would you think you have that?" I told him my symptoms. He was doubtful, but told the nurse to get me a Coke and made me chug it. Sent me to roam around the hospital for a little bit, then get blood work and come back. I came back, and his first words were, "This is so aggravating. Does that mean I have it?" "Yes, that means you have it." Story 9. I'm a nurse, but just had a patient who came in for a colonoscopy due to constipation and pain with bowel movements. He told me prior to the test he felt like there was something catching on the left side of his abdomen when he pooped and was like maybe I have a big polyp there or something. Sure enough, he ended up having a 2.5 centimeters polyp that we removed from that exact area. He'll never get to find out if that catching sensation ever went away for him, but I thought it was interesting that he was right. Story 10. Had a patient come into the ED and told me he had epiglottitis, an uncommon infection of the epiglottis, part of your throat. When I went to see him, I asked how he knew he'd had it before but was also a 90-year-old retired ED doctor. He was right. Story 11. Not a doctor, but in junior high I had a little cough that just wouldn't go away. My grandmother was convinced it was whooping cough. I felt totally fine, it was just an annoying cough. She made me go to the doctor and told the doctor that she thought I had whooping cough. The doctor informed her that it hadn't been in our area in over 10 years, so she doubted that was the case. My grandma forced her to test me for it anyway. Turned out I was positive and considered patient 0. The whole school basically ended up getting it and we had to shut down for 2 weeks until it went away. Story 12. I'm not a doctor, but this is what happened when my son self-diagnosed correctly. 3 years ago he developed a terrible earache and went to urgent care, where they told him he had an ear infection and gave him an antibiotic. The pain intensified over the next day or so he returned and was told he should make an appointment with an ENT, but because it was the weekend, no ENT offices were open, so he had to wait until Monday. In the meantime, his ear started draining and he saw what looked like spores in the fluid, which would indicate a fungal infection. He's a naturalist and knows what spores look like. The pain grew so intense that he ended up going to the ER. He told the doctor who examined him that he had seen spores in the drainage from his ear and suspected that he had a fungal infection. He later heard the doctor talking to a nurse in the hallway, laughing and saying, he thinks he saw spores. The doctor prescribed another antibiotic and a steroid. The next day he flew home to see us for Thanksgiving. I don't know how he managed the flight, because as soon as he got here, he curled up on the floor, howling in pain. I immediately called ENT offices all over town, but most were closed for Thanksgiving week or said they could not see him. Finally one scheduler took pity on him and said she would move things around to get him in. A PA examined him and confirmed that it was a fungal infection. She told him that the steroid he had been prescribed by the ER doctor was the same agent used in the laboratory to culture fungal infections. His infection had started to enter the eardrum and from there could have spread to his brain and killed him. She gave him a prescription that cleared up the infection very quickly. The wrong diagnoses at urgent care and the ER cost him over $1,500 out of pocket and several days of excruciating pain. The ENT's office did not take his insurance, but charged him only $250 for the correct diagnosis. Story 13. Patient here. I had a work accident. Opened the roll-up door on my delivery truck and the load of tires fell, hitting my shoulder and neck. Couple days later I started having fainting spells and my arm became swollen and discolored. Lots of neck and shoulder pain. Lots of doctors. Lots of tests. Lots of specialists. No diagnosis. I came up with a solution. I tore the anterior scalene muscle. As it healed it compressed the subclavian artery and nerve that go to the arm. Key to this explaining the swollen arm was a quirk of anatomy. The artery was compressed between where the carotid and vertebral arteries branched off. The carotid fed my brain but normal flow to the vertebral was cut off. So my body did a weird thing. It reversed the blood flow, pulling blood out of the circle of Willis, a loop of blood vessels in the brain, that was the only blood feeding my arm for several months. A Doppler ultrasound confirmed thoracic outlet syndrome with a subclavian steel retrograde blood flow in the vertebral artery. Story 14. I work as a medical lab tech. We had a patient who came in insisting that her neighbor was poisoning her. Everyone dismissed her assuming she has some kind of paranoid psychosis. She remained in the ER on a psych eval. I ran all the standard labs on her and they were normal, but this patient would not budge. She was admitted to psych on a hold. At this point, one of the hospitalists decided why not and ordered labs to test for several heavy metals and ethylene glycol. Her ethylene glycol level was 32. If she was legit being poisoned by her neighbor or if it was self-induced, but that patient taught me a very important lesson that day. Story 15. I'm a patient. I had a super painful skin infection on my face and neck that my dermatologist insisted was just an eczema flare-up. She prescribed topical steroids. They help in the short term, but I continued having painful rashes on my face. I asked if it could be a fungal rash, but the derm said she was sure it was eczema. Unfortunately, steroids weaken your immune system, thin your skin, and facilitate spreading of any infection. A few months later, my hands and fingernails get really painful. Life was hard because I was in pain when I tried to do normal things like write, type, open things, etc. Eventually, I started getting bleeding blisters on my hands and my actual nails turned yellow. I see the dermatologist because at this point I realize topical antifungals give me some relief, but I need oral antifungals to treat the actual nails. The dermatologist swore this was eczema dyshidrosis. I asked for a culture to be taken, and she took a swab, not a nail clipping, which is needed to diagnose fungal infections of the nails. So the diagnostic test of course came back negative. She prescribed steroids again, but I was hesitant to use them because at this point, I did not trust my dermatologist one bit. I see my PCP and tell him what's up. He agrees to try oral terbinafine and it worked. My nails fell out and grew back in, and the infection cleared up. The rashes on my face cleared up too. I was on the antifungal for 7 months. I had a follow-up with a dermatologist and showed her how the antifungals actually worked and to show her she was wrong. Story 16. Not a doctor, but a patient. I got mono at 16. It didn't leave. I was getting recurrences twice a year where my lymph nodes would swell and I would get sick just like the first time. My blood tests showing glaring red positives for mono markers. I got my tonsils out in my 20s and the mono seemed to subside. 2 years later I got all the same symptoms. Swollen lymph nodes, fatigue, all the rest. I went to the urgent care. The PA took one look at the bumps under my arms and prescribed me antibiotic cream for ingrown hair. I told him about the mono. He rolled his eyes and told me they were infected ingrown hairs. I insisted on a blood test, even if I had to pay out of pocket. Blood tests came back and not only was I positive for mono, the markers were 19 times the normal numbers for a positive case. This thread made me remember that story. Haven't thought about it in a while. Story 17. Patient here. Was through hiking the Appalachian Trail and was in Southern Virginia, near Roanoke. Was having a fine day until I went to pee in my motel room. Straight blood. Also had been getting weird spots and sores on my legs that didn't go above my waist or below my ankles. ER doctors, 3 of them all stated it was a tick-borne illness. Considering I had been hiking for a month in the woods, Rocky Mountain spotted fever probably, but I had that in college and knew it was, and I told the 4th ER doctor who came in that based on my Googling I had Henoch-Schönlein purpura, an autoimmune disorder that is very rare in adults. She agreed, sent me to Virginia Tech for a biopsy and they confirmed vasculitis. Went on to get arthritic pain in my knees and severe abdominal pains. Went for an ultrasound and discovered I had underlying autosomal dominant polycystic kidney disease, that after testing, I did not inherit from my parents. Doctors began talking to me like I should be in a textbook. 7 years later I am symptom-free and just taking a small dose of blood pressure meds but felt like I was on house for a few months there. Me doctor, I have a kidney stone. Dr. No blood in urine. Can't see anything on ultrasound. 3 days later me my stone is causing me pain and cold sweating. Dr. Let's talk about an x-ray of your spine. Dr. There is a slight misalignment. Could be trapped nerve. Referred to spinal surgeon. 2 days later me taking a WTF was that me. Dr. Here's the 4mm stone. Story 18. Patient. But I ran cross-country in college. My senior year my thigh aches. I told everyone something was wrong with my bone while being told it was a muscle issue. After being treated for every muscle issue in the book, I demanded an x-ray. I had a stress fracture more than halfway through my femur. Story 19. Not a doctor, and I don't play one on TV but nearly became a doctor half a lifetime ago. I diagnosed my husband's brain tumor, leading to emergency surgery. A month in and out of the ER, personality change, couldn't stay awake, diagnosed with a B12 deficiency, dehydration, frequent vomiting, vision looked weird but he could never explain. It turns out his peripheral vision was gone, and a swollen optic nerve, probably just high BP from ophthalmology. After a weekend where I could barely wake him up, he went back to the ER where he waited 4 hours in the waiting room. I asked him if anyone had done a CT or MRI of his brain, just throwing at the wall to see if anything stuck, and I assumed they had not, told him to insist on a CT, because I had a wild sneaking suspicion. 2 hours after being called back he was in an ambulance on his way to a different hospital with a neuro ICU to get scheduled for emergency brain surgery. Massive tumor with dangerous obstructive hydrocephalus. Story 20. Patient here. Halfway though my cancer treatment, tell them it's back. No one but mom listened to me. After 2 months of non-stop telling them they did a scan. Turns out yes, I had cancer again and look, it was getting close to being terminal. The student doctor learned to listen that day. Story 21. Patient here. I know, I'm sorry. I had been having various digestive troubles for a few weeks, but thought I was just recovering from food poisoning or at worst maybe developing something like IBSID. One night while I was lying in bed with my hands on my stomach, I felt a lump. Instantly nervous, I started pacing around my house, Googling symptoms. Of course WebMD and various articles kept suggesting cancer. But of course it's never cancer. Well, it was cancer, stage IVB ovarian to be exact. Whoops. Story 22. Patient here. My story is just a long and dumb story. I kept getting migraines more and more often. I started getting nosebleeds and blacking out at the gym. Then one day after the gym the migraine never stopped. So I went to my doctor, who gave me a Toradol shot. That didn't work, so he sent me to the ER. At sinusitis, go by a humidifier. I did, the migraine didn't go away. And I could hear my heartbeat too. So I made an appointment with an ENT. They ordered an MRI. And when they saw the results told me to see a neuro ASAP. They couldn't help me see one. Couldn't write a referral or anything. But I needed one as soon as humanly possible. So I called my GP. They sent referrals to every neuro in my area. I called 13 offices, made 13 appointments, and got put on 13 wait lists. I saw a neuro 2 days later, then called the other 12 back to cancel. Neuro was like, the MRI shows signs you might have too much cerebral spinal fluid in your brain, but MRIs don't actually see CSF, so all we can see is the side effects, thinning of the bone from the pressure wearing away at it, your pituitary gland is flattened, etc. We need to do an MRV and lumbar puncture to see what's actually happening with the cerebral spinal fluid. So we do that, and the pressure in my head is 40 when it should be 5 to 15. Cool. She puts me on meds to lower my CSF production. Okay, the pain does not change, she doesn't know why. So this neuro, because I was just trying to see any neuro, was a sleep specialist. I decided to change to a headache specialist for more specialized care. He changes the types of meds I'm on, but the pain basically is still agony. I ask him, hey, so, I read birth control can trigger this, should I take my IUD out? He's like, no, you should leave it in. It's stabilizing your hormones so your periods don't make things worse. I listened to him for a few months, then say it and have it removed. The pain dropped significantly within 3 days of removal, then I'm like, WTF. My ability to think clearly is not great, but I pull up my MRI and MRV reports and start reading them and doing research on what it all means. Transverse sinus stenosis. A cerebral spinal fluid vein was collapsed inside my head. So I went to my neuro and was like, hey, isn't this important? Shouldn't we have to fix this? Neuro, no, ignore that. So then I went to see a neuro-ophthalmologist. He was like, your eyes are fine, so your brain is fine, what you're feeling is migraine, the meds are working, go back to neuro. I was like, WTF, so I went to a different neuro. Me, I want a stent. Neuro looks up things on computer. Oh, you do have a stenosis. I'm not really a vein doctor. You need a stroke specialist. Let me refer you. Stroke specialist MRVs at showing you how bad a stenosis is. You need a neurosurgeon to go in there and take a look at it. Neurosurgeon, yeah, let's go take a look. So the neurosurgeon did an angiogram exploratory surgery and saw that the pressure in my head was still 40 after 2 years on the highest dosage of pressure-lowering medication. And I qualified for a stent to fix the vein. I was right. The pile of my previous doctors were wrong. I had to keep changing doctors and believe that the vein was the issues. And all my doctors were idiots until I finally got help. There's more dumb stuff that happened over last 5 years, but that's the major stuff. Story 23. A cousin from Sweden went on a trip through Africa. His aunt my MIL is a doctor in South Africa. She told him to call her if he has any symptoms when he goes back home because she knows that European doctors struggle with tropical diseases. He goes home, gets sick, calls her. She diagnoses bilharzia and tells him to repeat the treatment after 2 weeks. The standard single-course schedule never worked for her patients. So off he goes to these Swedish doctors who have never seen bilharzia and they don't really believe him, but since he was recently traveling they decided to test after all. It's bilharzia. And of course, they wouldn't repeat the treatment because their books specify a single course of medication. And of course, it returns. Eventually they prescribed 2 courses. As my MIL said in the beginning, he was fine after that. Story 24. Not a doctor. My friend diagnosed herself with HIV. She had swelling around her neck and the doctors weren't finding anything. She Googles her symptoms, calls me, says she thinks she is HIV positive. I spend the call trying to calm her down and telling her to get tested, but that probably isn't it. Her doctor also told her, there's no way, but she insisted on getting tested. Yep, she was right. Story 25. Patient here. I was right about having a pituitary microadenoma causing Cushing's disease. I asked multiple doctors to help me with various symptoms, including a neurologist, and it was missed for years. Finally a wonderful endocrinologist agreed to test my cortisol and it was sky high. 18 months out of surgery and I've lost 110 pounds. No longer diabetic, blood pressure is great. No more kidney stones. I had 8. Hair has grown back, glaucoma is gone, etc. Most doctors just wanted to diagnose obesity instead of seeing it as a symptom of something else. Story 26. When I was pregnant, I was hospitalized overnight due to one of my routine labs being abnormal. Along with high blood pressure, my liver enzymes were extremely high but everything else came back normal. I spent the night googling my labs and symptoms and asked my nurse if it could be HELLP syndrome, which is a very rare form of preeclampsia that can cause your liver to bleed and can kill both you and your baby if let go for too long. The only cure treatment is to deliver. She literally laughed at me and said there was no way I had it, because I would have been in more pain. 2 weeks later I had an emergency induction due to HELLP syndrome. Thankfully we are both okay, but I will never get over her being so flippant about something that easily could have killed us. Story 27. My sister started acting funny and passing out when I was about 16. Due to the area we lived in, my mom heard your daughter is on drugs. Send her to rehab and these issues will go away. Thing is, my family knows my sister and we were raised in a cult, meaning she would have been terrified of illegal drug use. 7 neurologists and our primary care physician insisted my mom was crazy and she needed rehab. Neurologist 8 saw 5 seconds of video and diagnosed her with epilepsy. Story 28. Another patient here. Wasn't wild for me but apparently for my doctor to set the scene. My mum has as, my great-grandpa had it. My grandpa isn't diagnosed but has a few symptoms. I was tested positive for the HLA-B27 gene as a toddler and grew up seeing my mum's symptoms and sometimes assisting her. At 19 or something I started getting mild pains that got worse in some situations. After some time, I went to an orthopedist near my house, easier to get an appointment and closer by than a rheumatologist. I served the whole thing on a silver platter for him. My mum has as, I have the gene that makes it more likely. Didn't know the name of the gene by heart back then. I'm having pains in a joint that my mum has had a lot of trouble with as well. In short, I think it's as, the doctor straight up told me, yeah, no way, there is no such gene. Your joint is just blocked. Tried to painfully unblock it to no avail and wanted to get me to accept some kind of shot into it. Not being a fan of needles, I declined that one, and decided to eat the waiting time and the longer drive to the rheumatologist instead. Surprise, surprise, I was right and I have as, exactly what I served on a silver platter to that idiot doctor who pretty much declared it impossible. Story 29. Patient, found a lump in my neck, saw Dr. 1, she said allergies, sent me home with antibiotics, found second lump in neck, saw Dr. 2, allergies, don't stress, All blood work is fine, different antibiotics. Antibiotics didn't help, saw Dr. 3. He was a little more suspicious, but because I was a young 19 years old he said I was fine and to try a different antibiotic. Went on to WebMD that night. Few days later saw Dr. 4. Said I know this is cancer, please do more tests. Sure as, stage 3 papillary and follicular thyroid cancer. Had major neck surgery 3 weeks later where they removed my thyroid, 2 parathyroids and 24 cancerous lymph nodes from my neck and chest. Have a 9-inch scar up to my ear, 14 years cancer-free since October 6th. Story 30. Not a doctor, but I correctly told my doctor that I had dengue fever. I had just returned from Puerto Rico, and had all of the symptoms, except for bleeding. The doctor dismissed my suggestion and told me that I had the flu. After a few days, he relented and had me get a blood test, and it was dengue fever. Story 31. Patient here. I've always known I have something wrong with my heart. I was never taken seriously as a child and a teen by anyone, and the PCPs I saw never did anything more than listen to it for a few seconds and tell me I was fine. I just learned what I could and couldn't do in my daily life to keep it from interfering, and over time sort of left it at the back of my mind. After a series of unrelated medical events over the course of a couple of years, I was aware of my heart getting worse. After much pressure and persistence, I got a referral to a cardiologist who told me to track my vitals on my Apple Watch for a few months and come back to him with the results. As he was off on leave until then, I was a bit bummed. It had taken a lot to get a referral to him and I was still being brushed off. Then COVID hit and everything pretty much shut down in my country for 2 years. During that time the only notable event was being hospitalized for kidney issues after severe gastro that left me so dehydrated I was hallucinating. Just before discharge I had a doc come around to do final OBS before releasing me. It was a teaching hospital, and he had a gaggle of students with him. He listened to my heart and got excited and then proceeded to use me to teach said students what an S3 heartbeat sounds like, and how to find it. None of his talk was directed to me, but I listened and I learned. I got myself the best portable ECG Holter type monitor I could afford and I wore it to take ambulatory EGCs and then I learned to interpret them, obviously not to a medical standard, but enough to be able to note the areas of concern, what abnormalities in the waves ID noted, my BP and what I'd been doing at the time, physical symptoms, etc. Then I went back to my cardiologist and told him I had WPW syndrome, and it was getting worse, and he needed to do something before it killed me. He scoffed at me, but I'd been expecting that and handed him pages and pages of relevant ECG recordings and asked him to at least prove me wrong. He looked over the ECGs and my notes, told me he knew medical students who weren't capable of this, which scares me tbh, ordered his own tests targeted on the info I'd gathered, and not too much later begrudgingly confirmed my diagnosis of WPW. 1 catheter ablation later, my life is much improved. Stupidest thing is, if I'd been taken seriously at any point prior it could have been managed with medication, and not done permanent, irreversible damage to my heart. I shouldn't have ever had to learn to read ECGs, nor spend hours on medical sites reading medical journals researching heart conditions. I'm still convinced I'm going to die of a heart attack, but at least it won't be today, or hopefully tomorrow. Story 32. Healthcare student premed here, but in this case I was the patient. There's a relatively rare genetic disorder that I correctly diagnosed my family with. We were looking at a case study to essentially familiarize ourselves with the concept of horses, not zebras, but also, zebras are real. For privacy, I don't want to name it or give the full details, but it's basically a disorder that affects multiple people each generation, but may manifest differently per person and can often be misdiagnosed as more common disorders. The symptoms and diagnosis each person in the case study had mirrored my dad's side of the family almost perfectly. Like it wasn't 11, but God if it wasn't freakishly close, so I pushed my surviving family members to participate in a genetic test for this disorder. We have it typically, it would have taken way more testing and investigation and tons of pushing back with doctors to get a diagnosis. They say most people wait 5 to 10 years for a diagnosis. In less than a year we were collectively diagnosed. Edit. While I appreciate and understand people's curiosity, I won't be disclosing the disorder. It's rare enough that I have a perhaps paranoid fear of being identified online from it. People who I know IRL are on Reddit. Story 33. UK based, so apologies for any unfamiliar terms for other Redditors. Not answering the question, but I say it's an adjacent scenario. My best mate growing up is now a consultant, but after completing his training to become a doctor he then studied at the Liverpool School of Tropical Medicine. He had been working abroad in South America as an expedition medic and came home for a few weeks to our relatively small rural town. We have a relatively small hospital, but as it's the only one for several hours it's fairly well equipped for the size of the town. He started to come down with something and it was hitting him pretty hard, and he ended up in an isolation unit as they couldn't diagnose him, but given his background he ended up with consultants, doctors and student doctors from all over the hospital coming to see him to ask his thoughts on it, and what the best course of treatment would be, given that he was the only person in the entire hospital actually qualified or experienced to deal with it. Edit. Sorry folks, I left out what it was. I'm fairly certain he had Western Nile virus. Story 34. Not a doctor but a patient. I have UTIs that are asymptomatic until I have blood in the urine. Was probably on my 3rd or 4th one at this point, so went to urgent care. The doctor was convinced I was on my period and on seasonal birth control. Even asked how I knew I wasn't. Luckily the test showed a UTI, gave me Cipro. I was back in 2 days later because I was having heart palpitations, anxiety, and a fast heart rate. I was having a reaction to the Cipro and asked to be put on another antibiotic. Doctor thought I was crazy but agreed to let me switch. Issues went away the next day. When I got a PCP finally, she said it was a definite reaction to Cipro, and while not an allergic reaction per se, to list it as such to make sure I don't get put on it again, she was mad the doc dismissed for both the UTI and Cipro issues. Story 35. My husband was the patient, so not a doctor, but he starts having severe stomach pain. Eventually it's so bad he can't stand up straight, so when he gets home from work, we go to the ER at the IHS. She examines him and says he's constipated. We think this is weird BC, he's been pooping, but okay, we will take the stuff. I'm convinced though it has to be like appendix gallbladder something like that. A few weeks later, it's still bad now, he's bloated and gained weight seemingly and has severe night sweats, which was new, but following doctor orders, middle of his shift, texts me he's going to the ER again. BC, something is wrong, he can just tell. Little while later, phone call that they are ambulancing him to the nearby city because a couple weeks ago, his appendix ruptured and was now the size of a football and he was just filling up with sepsis. We knew it, but got told to take laxatives. Not wild, but it was just shocking. 1 year later exactly it happened again when he was on a work trip in Fargo and he had to drive himself to the ER. That time, they removed it. Story 36. Patient here. I have always had a lot of random, seemingly unrelated health problems, issues that no normal person would generally link together. A new one cropped up a couple of years ago, so I started doing research on it. I read about a very rare estimated 160,000 people genetic condition whose signs and symptoms matched many issues I'd had even since childhood. Made an appointment with a genetic counselor who specializes in it, thinking they'd tell me I was crazy. Instead they confirmed I have it, albeit a thankfully mild case. It's so rare that most of my other doctors haven't even heard of it. No one in my family has it either, so it just randomly showed up in me. Story 37. Patient here. Fell out of a taxi after a day of drinking. Got to my mum's house and I just knew I'd broken my ankle again. I knew the pain, I knew the swelling. Mum takes my drunk to AE, and I think because I was still very hammered, they left me in a wheelchair for 12 hours before I had an x-ray, and sure enough, my ankle was broken in 2 places. Story 38. It happened to me as a patient 4 times. On the first occasion, I was 15 and started having bouts of severe abdominal pain and developed irregular periods. My mum took me to the GP so many times, and they just kept blowing it off as anxiety or just my period. Got a half-assed diagnosis of it could be endometriosis. Track your periods for 3 months and come back. I kept going to school, etc. because I had no choice but kept gradually getting sicker. Went to Comic-Con with friends and projectile vomited on the con floor. That was embarrassing AF. Was in intense pain the whole weekend, and when I got home, I went straight to bed. Woke up at 3 a.m. in so much pain I could barely move. Woke my mum up and told her I thought I was dying. Got rushed to hospital by ambulance, and the first doc we saw said it was constipation. Mum went nuts and demanded a second opinion, and I was admitted for observation. 4 p.m. the new doctor finally sees me and sends me for an immediate scan because I'd gone gray and was barely responsive. The scan showed a massive growth on my ovary and an ovarian torsion, and I was taken to the theater immediately. On the way to theater, I genuinely thought that was it, and I was about to die. I did stop breathing on the table, but obviously I did survive it, mostly thanks to my mum digging in her heels and fighting for me. She told me at the time she had a gut feeling that if I was sent home, I would have died. And she was right, as by the time I made it to theater, I was already going septic. Mums just know. Second time, I was at uni and had the most blinding pain in my kidneys. It was so bad I collapsed in my uni house kitchen, and my housemates had to call an ambulance. It felt like someone was tearing my sides apart, and it was all I could do not to scream continuously. I got given morphine and gas and air in AE, and my urine test was positive for blood, was eventually seen by a doctor, and I told him I thought it might have been a kidney stone as those run in my family. He laughed and said, "You're only 22, you're way too young for that, it's probably a UTI, but we'll do a CT to rule it out." I got the scan and a few hours later, the same doctor returned and sheepishly told me it was indeed a kidney stone. I was sent home with hefty painkillers and pissed it out 2 days later. Third one again while at uni. Started feeling unwell during a lecture. By the end of the lecture, I was pale, clammy, and was struggling to stand upright. I had searing pain in my lower right abdomen and just knew it was my appendix. I went to AE and had blood tests, etc. They came back normal, and I was told it's gastroenteritis and was sent home. Didn't sleep all night and went to my GP the next day. She sent me to the hospital because she didn't like my symptoms. They did blood tests again, and they were still normal, but I felt and looked like, I asked them if it could be appendicitis and was told no because if it was your labs wouldn't be normal. They discharged me again. 7 hours later, I woke up and started puking and couldn't stop. Again, my housemates called an ambulance. This time, the surgeon actually bothered to feel my abdomen as no one had done that, and when he pushed on the painful area and let go, I almost flew off the bed and screamed. He said it might be appendicitis, but it was unlikely, but because of that reaction, he was going to do a laparoscopy and see. Dear reader, it was appendicitis, and the thing burst as they were removing it. A serious complaint went into the hospital after that. The fourth one happened recently. I've had ongoing upper abdominal pain, reflux, and heartburn since February, and it's been slowly getting worse. I've had multiple appointments with the GP, who has been very dismissive, just referring me to specialists and prescribing painkillers. I have EDS and we are prone to weird going on with our organs, so after having a few basic scans that didn't show anything, I asked if it could be a hiatus hernia as I have all the signs including weight loss, lack of appetite, nausea, and difficulty swallowing food. He all but rolled his eyes and said it's unlikely because of my age but sent me for an endoscopy anyway. I have a hiatus hernia. Not just that but a particularly rare type where the stomach is actually herniating up into the esophagus, so now I'm waiting to find out what they're going to do about it. All of these occasions I voiced that I just had a gut feeling about it, but am always scoffed at or not listened to and then never apologized to when it turns out I'm right. Some doctors let their egos get in the way and could absolutely do with more lessons on actually listening to the patient and not blindly going by the textbook. I'm convinced that when I do eventually kick the bucket, it will be because a doctor didn't take me seriously.